Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
In today's Neighborhood Health Watch, we are talking about minimally invasive gynecological surgery. Conditions such as endometriosis or fibroids can be treated with a single incision procedure, and that means less pain and less recovery time for you. So we've got the expert. This is Dr. Boyd Clary from Henrico Doctors Hospital here to explain. Thanks so much for being with us.
Thank you for having me.
It sounds like amazing progress has been made with this procedure.
Absolutely. So we are doing things through smaller and smaller incisions. So an incision often smaller than my thumb to do very large hysterectomies. So for example, 20-week size uteruses done through minimally invasive techniques. Fast recovery, fast return to work, often by 2 weeks.
Wow, that's amazing. And we were discussing before we got started here that it's really something that's available to a lot more people than they might think.
Absolutely. So classically, people used to think of these minimally invasive procedures are just cases for very thin or people. And the reality is that they are great options for heavier people, great options for everybody. And so very rarely do we have to do an open or a big incision like a C-section, or even worse, a big vertical scar. And that actually has benefits even for people who are more sick or a little less healthy, because it's a fast recovery, less infection, less pain, fast return to normal life activities.
Yeah, that's amazing. We touched on fibroids and endometriosis, but let's talk about some of the different conditions that this can help.
Sure. So heavy bleeding. So hysterectomy, for example, is a great procedure for doing this, but also benign tumors of the uterus, which would be fibroids, taking them out laparoscopically through a very small incision and in a safe manner, because there's been a lot of news recently about doing laparoscopic myomectomies and increasing the rate of cancer. And so we do have an incision that's big enough to get them out safely without exposing you to more risk.
Okay, and people should just talk to their doctor about this option,
Yes.
right?
So there are many people in the city who do this, and actually we're very lucky. Henrico Doctors is one of the leading hospitals on the East Coast for single-site surgery.
Okay, you said you performed quite a few of them
I
yourself.
have actually do quite a few. So in the region, I was the first in the region to do it about 8 years ago. Been doing it for 8 years, and probably in the top 20 in terms of hysterectomies in the East Coast for single-site laparoscopic minimally invasive surgery.
You've really seen the difference that it can make for your patients.
And patients really talk about it. So I literally have patients sometimes as early as 10 days, self-employed, motivated, but getting back to work and able to do jobs as long as they're not doing heavy lifting.
Wow, that's fantastic. Well, Dr. Clary, thanks so much for being with us today.
Thank you for having me.